You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. Today, more than half of all surgeries performed in the U.S. are done on an outpatient basis. Advances in surgical techniques, anesthesia, and pain management have all contributed to healthcare that allows patients to recover from surgery safely and comfortably in their own homes. Prevea Health is making outpatient surgeries and procedures more accessible in Northeast Wisconsin with the addition of a new state-of-the-art ambulatory surgery center in Green Bay. The Prevea Surgery Center is a nonprofit facility owned by HSHS St. Vincent Hospital and managed by Prevea Health. On this episode of Plug Into Health, we welcome Dr. Padraic Obma, the medical director of the Prevea Surgery Center, and Angie Perronne, the director of the Prevea Surgery Center. Thank you both for being here.
Thanks for having us.
So, Dr. Obma, let's start with you. For people who are hearing for the first time the words Ambulatory Surgery Center, or ASC, what is it?
I've thought about this question a lot myself. It seems like, in general terms, an outpatient surgery center is something that people can relate to, and it's somewhat self-explanatory where you go for outpatient surgery. It's much deeper than that, though, because you can have surgical procedures there, but you can have other procedures there. One of the great things about the Prevea Surgery Center is that we do not just surgeries there, but also other types of procedures such as colonoscopies or steroid injections. So it's kind of a comprehensive place to get outpatient procedural care, whether that's a surgery or a variety of different procedures. We traditionally think of having procedures in a hospital setting, kind of the brick and mortar 3 to 5 story building. This is much more simply accessible, much more approachable way of getting procedural care.
Yeah, it's freestanding in most cases, an ambulatory surgery center versus being located within a hospital. And, good to clarify, there are still many, many surgeries that are absolutely needed to be done still in a hospital. But an ASC really is for more select procedures and surgeries?
Yeah, certainly. In general, it would be lower risk procedures. However, with the pandemic, we've moved more and more procedures to an outpatient setting. So the ambulatory surgery center or outpatient surgery center has become much more the center or starring role for a lot of procedures within healthcare over the last 2.5 years. So it's absolutely perfect timing for Prevea to be launching their surgery center in the Green Bay area.
Some ambulatory surgery centers only offer one type of medical specialty, we'll say, such as orthopedics. The Prevea Surgery Center, however, can accommodate for multiple types of specialties. Angie, what are those, and what are some of the common surgeries and procedures performed there?
Sure. So we've designed this surgery center to accommodate 5 different specialties, if you will, to be a multi-specialty surgery center. Orthopedics and podiatry being one of them for sure. We also can do urology cases there. ENT or cases such as tonsils, adenoids, ear tubes for children can be done in the surgery center as well. Plastic surgery cases and also cataract cases, in addition to the GI cases such as colonoscopies, as Dr. Obma was talking to, or scopes, upper endoscopy scopes that can be done.
Really is a beautiful facility, the Prevea Surgery Center. Can you talk a little bit about how it's designed and what it's comprised of?
Sure. The building is just beautiful. They really designed it for ease of use for the patients, family members, and staff as well. You'll see there's color-coded hallways. Each hallway has a different color to make wayfinding easy when you're in the building, because it is a large building, but we want to make it feel very comfortable and secure. Patients know where to go, and their family members know where to go too. So it's a great building for that kind of home-like feeling in a smaller setting.
Yeah, and it's really comprised of you have rooms where you would go before your procedure and after. You have actual procedure rooms and surgical or ORs, I should say. Can you talk a little bit about that?
Sure. We have 28, we call them prep and recovery rooms. The nice thing of that is the patient starts in the same room as they will end in, so it's very familiar and comfortable for them. And sometimes the family members can even just stay in those rooms if they're having a short procedure, so there's less, back and forth. So we have the 28 prep and recovery rooms. We also have 10 procedure rooms where cases such as the cataracts, colonoscopies will be done. Some of the smaller, quicker procedures are done in the procedure rooms. And then we also have 5 operating rooms where some of the bigger cases will be done, such as knee scopes, shoulder scopes, that kind of thing.
How does someone schedule a procedure or a surgery at the Prevea Surgery Center?
The easy answer to that is call and schedule an appointment with one of the providers at Prevea Health. Through that mechanism, your provider will evaluate you and determine if conservative care or non-surgical care is appropriate, or if potentially surgical or procedural care is appropriate. At that point, you would probably be referred to a surgeon or a proceduralist, a specialist, if you will, and they would then determine if you'd be a candidate for surgery. At that point, a surgery or procedure would be scheduled and handled by one of the talented Prevea specialists. And they would then determine if your surgery would be done at a hospital or hopefully the Prevea Surgery Center. As we are coming online, we offer a variety of specialties and procedures, which is very exciting. And more often than not, if it would be a low-risk outpatient surgery, it would be done at the Prevea Surgery Center.
So to help give our listeners a better idea of how the Prevea Surgery Center works, Angie, if you can, walk us through step-by-step how a patient might experience it from start to finish. So we'll say I'm 45 years old and it's time for me to get my first colonoscopy. And this is where I've been referred to for my colonoscopy. How would I experience the ASC or the Prevea Surgery Center?
Typically, if someone needed a colonoscopy, the referral would come from their primary care physician right into our Epic system, where we would then schedule the procedure for them. And the care really starts before the day of the procedure. We have a pre-anesthesia nurse who will reach out to the patient, review medical history, and just answer any questions that they have, help them feel at ease, let them know what time to arrive. Get them all set and ready for their day of surgery. When they come that morning or afternoon of surgery, they will be greeted in the front by the receptionist to get them all checked in, make sure their family member is comfortable. They can sit in the nice waiting room that we have for them. There's some snacks, some coffee there. Wi-Fi is available for them to just kind of relax while the nurse will come and take the patient back to the prep room and just get them ready for surgery, do whatever they need to do to get them ready. After that, the nurse who will be in the procedure room or the operating room with them will come and take them back on the cart, back to the procedure room or OR, do the procedure, come back out into that PACU or recovery area where they're just kind of waking up from anesthesia. As soon as they are awake, we make a quick effort to get that family member back with the patient. In the meantime, the doctor is able to go talk to the family member, let them know how things went. But the real great part of this center is we also have the capability to give texts or alerts to the family members during the procedure. How are things going? Just keeping them updated, in addition to the status boards that we have around the building that they can kind of watch the progress of their loved one through the day as well.
And it's also been designed to ensure, the privacy and comfort of patients as they're being discharged from the surgery center.
Right. We do have a separate exit for the discharge of the patient, and we also have private rooms with glass doors, so really being very careful and considerate of their privacy while they're at the surgery center.
Having an outpatient surgery or procedure done at an ASC, like the Prevea Surgery Center, versus in a hospital setting, has some key benefits for patients. three of them being quality, value, and convenience. Dr. Obma, talk to us about the quality of care that one receives in an ASC.
Yeah, so I would just generally say that Prevea Health provides an exceptional high quality of care along with our HSHS partners in Wisconsin. And then we're taking that exceptionally high level quality care and bringing that to an ambulatory surgery center. So it's kind of the best of both worlds. You've already got this established exceptional care in this area, and we're bringing it into a new venue that can provide exceptional quality. One of the things I love about operating in a surgery center is that there's more of a focus on certain procedures. So in orthopedics, we might be focused on 15 or 20 different procedures instead of 50. So our team is very tuned into the procedures that we're doing. They do them with more repetition, so they have more experience, so there's less surprises. So we can have more focus at a surgery center, and we can then, by practicing the same procedures, doing the same procedures, you create efficiencies and higher quality because you're doing those more. It's just a simple thing. The more you do things, the better you get. And we get that at an ambulatory surgery center.
And in some ways, making more room for the surgeries that are needed to be done in the hospitals and our HSHS hospital partners.
So that's an excellent point. I think going through the pandemic of 2020 and 2021, we saw how stretched to the limits our health systems were. So by bringing the Prevea Surgery Center into this market, which was super inundated, we're actually providing Northeast Wisconsin with another exceptional area to receive care. I think we'd give a lot of credit to Dr. Rye, who kind of led us through the 2020 and 2021 pandemic and had the vision to bring this online to kind of help with the exceptionally high quality of care that we're delivering in this area.
We also hear about value with an ambulatory surgery center. Are we talking about actual cost savings there?
We're definitely talking about cost savings. And one of the visions of the Prevea Surgery Center is bringing GI procedures such as colonoscopies into the surgery center arena rather than in the hospitals. And that translates into direct cost savings for both patients and insurance companies. So we are literally driving down the cost of healthcare with this move into the Prevea Surgery Center.
Mm-hmm. And is it less costs in most cases in the ambulatory surgery center because there's not as much overhead cost versus, say, a hospital setting?
So there's a variety of reasons why there is lower costs. And there can be some overhead reasons. Additionally, we can be a little bit more nimble in a surgery center. Like Angie and I are going through right now cost containment strategies that will be passed directly to patients and insurers. One of those is, in my world, orthopedics, we place implants such as anchors or knee replacements or hip replacements. And Angie and I, along with our HSHS and Prevea team members, are working at finding cost-effective solutions for those implants, and that cost savings gets then translated directly to patients and insurers, so we can have a little bit more autonomy and be a little bit more focused on some of these cost containment measures that you might not be able to in a larger healthcare facility with some legacy contracts in place.
Mm-hmm. And let's talk a little bit about convenience. I think we've covered that a little bit, but why is it more convenient if I can have a procedure at an ambulatory surgery center, if I'm qualified to have a procedure there versus in a hospital setting? What are the conveniences of the ASC?
Yeah, so Angie has a great line. One of the great things about the ASC is there's one door in and one door out. It's a very easy, convenient way to navigate care for patients and providers. If you think about a traditional hospital, like you think, well, where's the entry? There's 6 different doors and 5 different elevators. At the Prevea Surgery Center, you drive up, you're dropped off at the check-in, you go through the whole process, and you're picked up at the checkout. It's very unintimidating. I find it a very safe, effective, approachable way to get health care for patients. I think a lot of those intimidating barriers are broken down, and it's a very welcoming, caring environment for patients and their families.
Will ASCs like the Prevea Surgery Center become a larger part of healthcare going forward? If so, why?
So that's 100% the way it is headed right now. And there's a variety of reasons for that. It was already heading in that direction, and then the pandemic accelerated that. There are so many different articles out right now that showing roughly 50% of all procedures are heading to ambulatory surgery centers, and it's increasing in the future. It's not dissimilar to what you see in, let's like the mainstream economy. Big box retailers are a little bit like hospitals. They're still super important, but so much of it is getting fragmented, and ambulatory surgery centers, such as the Prevea Surgery Center, is a much more approachable way to deliver high quality, safe, effective care to patients, their families, and the healthcare community at large. So it's 100% moving in that direction. That's why it's so exciting that Prevea is the first in our area to have a fully comprehensive surgery center. So I'm very proud to be part of the Prevea Health Organization and being part of the Prevea Surgery Center with Angie.
Yeah, Angie, what are your thoughts? Is this the way of healthcare going forward? More of these ambulatory surgery center settings?
Yes, I definitely agree. You see articles every day talking about, more and more surgery centers being built and how great they are, not only for the patients, family members, but the, saving healthcare dollars as well. So definitely will continue to be the wave of the future.
Dr. Obma and Angie, thank you so much for your expertise and for being here with us. To learn more about the Prevea Surgery Center, please visit prevea.com/surgery center. Thank you for listening to this episode of Plug Into Health. You've been listening to Plug Into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.